An envelope arrives in the mail. Inside, a bill that used to run for pages. This time, it's one line. Balance due, zero. Not a mistake. Not a coupon. A new reality, quietly built into law over the past year. Because in 2026, four specific costs for seniors are being absorbed differently than ever before. Not by charity, not by luck, by policy. Tax code changes, a hard cap on prescription costs, energy assistance expanded, food assistance still running, often unclaimed. Most seniors don't know all four exist. Even fewer are using all four at once. This is the story of what's actually being covered right now, and what most people are still paying for without realizing they don't have to. Stay with me. For decades, there was no ceiling. A senior on multiple medications could watch their pharmacy bill climb every single year. Blood pressure medication, cholesterol drugs, insulin. Add a cancer diagnosis or a rare condition requiring specialty drugs, and the number could spiral into the tens of thousands annually. Medicare Part D helped, but it never had a real ceiling. Beneficiaries moved through a maze of coverage phases: deductible, initial coverage, something insiders called the donut hole, a gap where costs suddenly jumped right when people needed help the most. Then catastrophic coverage, which still left people paying a percentage of costs with no upper limit at all. Families sold assets to cover cancer treatment. Retirees rationed insulin. Cutting doses to stretch a prescription meant to last half as long. Doctors saw it happen in their own offices. Patients skipping refills near the end of the year, hoping to make a bottle last just a few more weeks. Then the law changed. Starting in 2025, for the first time, Medicare Part D got a real hard cap: $2,000. Total out of pocket for the entire year. Not per prescription, not per month, for everything. In 2026, that cap adjusted slightly upward, landing just over $2,100. But the core principle held. Once a beneficiary hits that number, covered medications cost nothing for the rest of the year. Zero. For someone managing a serious chronic illness, that single change can mean thousands of dollars kept in their pocket annually. A senior on multiple high cost medications who once paid six, seven, sometimes $10,000 a year now knows exactly where the number stops. And once it stops, it stays stopped until January. Pharmacists describe watching the shift happen at the counter, a patient bracing for a familiar, painful total, instead hearing the word covered. Some don't believe it at first. They ask the pharmacist to check again. This isn't charity. It isn't a limited time program. It's now written into how Medicare Part D operates every single year going forward. But there's a catch most people don't realize. The cap only applies to drugs actually covered under a Part D formulary. Medications administered in an outpatient hospital setting don't count. Over the counter supplements don't count. Anything outside your specific plan's approved drug list doesn't count either. Which means the real first step isn't just knowing the cap exists, it's making sure your plan and your specific medications actually qualify for it. Two seniors on the exact same medication can have very different experiences, depending entirely on which plan they enrolled in. One plan lists the drug on its formulary, another doesn't. Same illness, same prescription, two completely different bills. Pharmacists and Medicare counselors say the same thing again and again. Check your plan's formulary. Confirm your medications are listed. Because the safety net is real, but only for the prescriptions it's actually built to catch. For millions of seniors managing chronic conditions, this quiet cap is the first of four costs now being fundamentally reshaped in 2026. But it's far from the only one. Prescriptions are only one line on a senior's monthly budget. Two others quietly eat away at fixed incomes every single month: the electric bill and the grocery bill. Start with energy. For a retiree on a fixed income, a heating bill in January or a cooling bill in July isn't a minor expense. It's often one of the largest recurring costs they face, competing directly with rent and medication. In extreme regions, that competition can turn dangerous. Every year, public health officials track cases of seniors hospitalized for heat exhaustion because they kept the air conditioner off to save money. Others develop respiratory problems from underheated homes in winter, again to cut costs. That's where LIHEAP comes in, the Low Income Home Energy Assistance Program. It's not new, it's been around for decades. But in 2026, expanded funding and outreach pushed it further into the spotlight, especially as energy costs climbed nationally. The program works simply. Qualifying seniors can receive direct assistance covering a portion, sometimes the majority, of their heating and cooling costs. In some states, for the lowest income seniors, that assistance can eliminate the bill almost entirely for certain months. The application isn't complicated. It runs through state and local agencies, tied to income thresholds that adjust based on household size and location. Yet advocacy groups estimate a significant portion of eligible seniors never apply. Some don't know the program exists. Others assume they won't qualify and never check. Some simply find the paperwork intimidating and give up partway through. Caseworkers say the fix is often just one phone call, one conversation that walks a senior through a form they assumed would take hours. The second recurring cost is food. SNAP, the Supplemental Nutrition Assistance Program, remains one of the most underused benefits among seniors nationally. Multiple advocacy organizations tracking participation rates found the same troubling pattern. Millions of eligible seniors never enroll. Some assume the program is only for younger families with children. Others worry, incorrectly, that receiving SNAP will affect other benefits they rely on. There's also a quieter reason: pride. Caseworkers describe seniors who worked their entire lives and now feel uncomfortable asking for what they consider government handouts, even when the program exists specifically for people in their exact situation. For those who do enroll, the monthly benefit can meaningfully offset grocery costs, especially for someone living alone on a fixed Social Security check. Combined with local senior nutrition programs, some of which provide subsidized or fully covered meals through community centers, food costs for a portion of the senior population have effectively dropped to near zero in certain months. Here's what makes this story different from a simple list of programs. None of these benefits are new discoveries. LIHEAP has existed for years. SNAP has existed even longer. What's changed in 2026 is the scale of unclaimed benefits and growing pressure on agencies to close that gap. State offices have started sending more direct outreach. Some are proactively identifying seniors who qualify based on existing Social Security data, rather than waiting for an application to arrive. Letters, postcards, even phone calls from local aging offices, checking in to see if a senior has applied yet. The message from benefits counselors has become consistent and urgent. These programs were never meant to sit unused. Every year a senior doesn't apply is a year they paid full price for something the system was already prepared to help cover. Between the medication cap, energy assistance, and food assistance, 3 of the 4 major recurring costs are already shifting. But the fourth may be the most surprising of all, because it isn't a bill seniors pay monthly, it's one they pay once a year. And for many, in 2026, that bill just disappeared entirely. Every spring, it was the same ritual: gather the documents, calculate the income, brace for what's owed. For millions of retirees, federal income tax was one more expense layered on top of already tight monthly budgets. Even modest Social Security income, combined with a small pension or retirement account withdrawal, could push someone into owing money they didn't have much room to spare. Some retirees described dreading tax season more than any other time of year, not because the amount was enormous, because it competed directly with money already allocated for rent or medication. That changed with a piece of legislation signed into law in the summer of 2025. Buried inside a larger tax package was a provision aimed specifically at older Americans: a new deduction. $6,000 for individuals 65 and older, $12,000 for married couples where both spouses qualify. This wasn't a replacement for existing deductions, it stacked on top of them. on top of the standard deduction, on top of the additional deduction seniors already received for their age. For a retiree filing individually with modest income, the math started working in their favor in a way it hadn't in years. Combine the new senior deduction with the existing standard deduction, and a significant portion of income became shielded from federal taxation entirely. For many middle income retirees, the result wasn't just a smaller tax bill, it was no tax bill at all. Zero owed, filed, and finished for the first time in years. Financial advisors who work with retirees started seeing the pattern immediately during the 2026 filing season. Clients who had budgeted for a tax payment every spring suddenly didn't need to. Some called their advisors just to confirm the number was right, certain there had been a mistake somewhere in the calculation. That freed up money, often a few $1,000s, went straight back into covering rent, medication, or simply building a small cushion of savings. For some, it was the first time in years they'd had anything left over at all. There's a catch, the same way there's a catch with the prescription cap. The deduction phases out at higher income levels: $75,000 for individuals, $150,000 for joint filers. Above those thresholds, the benefit shrinks and eventually disappears. And the provision itself isn't permanent. It's currently written into law through the 2028 tax year, which means the clock on this particular benefit is already running. But for the retirees living closest to the edge, the ones this change was actually built for, the impact has been significant. 4 separate costs: prescription drugs, capped for the first time in Medicare's history; energy bills, offset through expanded assistance many still aren't claiming; grocery costs, reduced through a benefit millions qualify for but never apply to; and now, for a large share of retirees, an annual tax bill that simply doesn't exist anymore. None of these 4 programs were bundled together intentionally. They came from different pieces of legislation, different agencies, different years of policy debate. But laid side by side in 2026, they add up to something that looks, from a distance, like a coordinated shift. Whether that was ever the plan in Washington, or simply 4 separate battles that happened to land in the same year, the result for eligible seniors is the same. 4 bills that once climbed every year, now capped, reduced, or erased entirely. None of this happens automatically for everyone. The Medicare cap only protects drugs on your plan's formulary. Energy and food assistance require an actual application most eligible seniors still haven't filed. The tax deduction depends on income falling under the right threshold, and it's only guaranteed through 2028. This isn't a story about free money falling from the sky. It's a story about a system that finally built in real limits, real caps, real relief, sitting there, waiting for people to claim it. If you're a senior, or you have a parent who is, the 4 questions are simple. Is your medication plan tracking toward that annual cap? Have you applied for energy assistance this year? Have you checked your eligibility for food assistance? Has your tax preparer accounted for the new senior deduction? 4 questions. Potentially thousands of dollars in real, legitimate difference. The bills didn't disappear on their own. Someone has to actually ask